We've also heard from the Federation of Labor on the legislation. Laird Krog says workers struggling with a COVID-19 illness face far greater than 3 days of lost pay. They face potential economic devastation. Ensuring workers don't have to make the untenable decision between staying home with symptoms or working sick to put food on the table is crucial here. So, with the fact that it's only 3 days and people will remain home for an extended period of time, do you think this is actually enough to ensure that people make that decision to stay home rather than go to work with potential symptoms?
Well, I do believe it's going to be sufficient to get that test done, to get the result from that test, and then to access the other programs that are available, whether it be through the presumptive COVID work that we did with WorkSafe back last spring, or accessing the federal program that currently exists, or long-term disability through the Employment Insurance Act, which I believe would be the best mechanism to deliver a paid sick leave program. I've made that abundantly clear as well. So is it sufficient for the moment? I believe it is. And will we improve it through the consultation? I certainly hope we do.
Richard, do you have a follow-up? Richard, are you there?
I am. One of the big gaps here from the federal program is how quickly, how people make that decision. So if someone in this case is feeling symptoms and their roommate or someone who lives in their house is not showing symptoms, can that person in the house also get support, or should they be going to work? Like, we know that, based on what we're seeing in closures in Fraser Health, that, this is an issue that's happening in those communities. We know it's a higher likelihood of intergenerational households. So is there support for people in the household? How do you even prove that you're showing symptoms? Like, how is it going to work in terms of preventing that decision from being made to go to work when you feel there may be risk that you can spread the virus to others?
The legislation provides for 3 days of paid leave, sick leave, and that allows workers to make that choice knowing that they're not going to have an interruption in their salary. That was the big challenge with the federal program. First of all, the quantum, the amount was too low. It would cover minimum wage employees only. This will allow for a top-up and a bridge for businesses that have higher paid employees, and it will allow for sufficient time to get a test done, to get a result from that test, and then to make choices about what the individual does from that point on, accessing any number of other programs. A hypothetical about who lives where and how is beyond the scope of the legislation. We're hoping that people make the right choices for themselves, their families, and the businesses that they work in, and that's the intent here. And I have to say that on balance, British Columbians have met that challenge over the past 15 months with great hardship in many instances, sacrifices by workers, sacrifices by governments. But despite that, we've got to this point where we've had, as of this morning, 49% of those eligible for vaccines have taken up a first dose. Over 2.1 million British Columbians. We have a steady stream of vaccines coming into BC. People are registering in record numbers. This is all positive news, but we are not out of the woods yet. That's why this legislation is so critically important at this pivotal time. And I'm confident that leaving it in place and funded by the province to the end of the calendar year will give us the time to have the discussion about how can we refine this. I left it to the federal government to do this work because they said in good faith they would do so. It didn't meet the test of workers, and so we need to pivot and make amendments, and that's what we're doing today. Government is all about taking circumstances as they come your way and making the best of it for the people that you represent, and that's what Minister Baines and I are announcing today. And if there are improvements that we can make between now and January 1, we'll absolutely do that.
Next question is from Katie DeRosa, Vancouver Sun.
Hi, Premier. You are continuously saying that the federal program is inadequate. But again, the current program that BC is coming up with only provides for 3 days, and then people have to go into, what you're calling an inadequate measure by the federal government. So again, why not have a longer period of time to cover people so that they, because again, the federal program, they have to apply, and it could be weeks before they get that money, whereas the provincial government would provide the money, to employees. And, the Yukon, I think, has had up to 10 days. So, why, again, only 3 days, which is comparable to the Ontario program, which has been criticized.
Well, I don't know what I can say, Katie, to allay your concerns about this. There are a range of programs available that we brought in and the federal government has brought in to protect people. And when it comes to paid sick leave, it's been inadequate. We believe the 3 days covered by the province will bridge people to either the CS, the second CERB, or unemployment insurance, or the presumptive COVID regulations that we brought in that will protect workers who contract COVID in their workplace. That then becomes a workers' compensation question, the only province in the country to do that as well. I believe that we're circling as best we can around this challenge, and I'm confident that what we brought forward is certainly superior to the program in Ontario in terms of the quantum of dollars, as well as the fact that we're not only carrying it on 3 months, 4 months past the expiry date in Ontario, but we're going to make it permanent January 1. In addition to that, and I was very grateful for the support of the Yukon when I was making my arguments, but let's be candid, 40,000 people in the Yukon Territory does not translate as easily to 5 million people in British Columbia.